Namaskar and greetings to everyone. And I'm thankful to the organizer for inviting me here. And before uh, here, I'm going to talk about UnivLabs. UnivLabs is a medical devices company, and before starting this company, I used to work in US in a multinational. Then the journey of this company started from Lucknow only. Uh, my company sent me to SGPGI Lucknow, and there I saw some things which totally transformed my mind. And I thought that now it's the time to build India's most, like India's most, and one of the globally acknowledged medical devices company from India. And as you see, the company in which I used to work, there the vision was care for you. So being born in this country where we talk about Vasudhaiva Kutumbakam, it is like the things cannot be about you. It should be for all. So the philosophy evolved care for all. So the vision of UnivLabs is novel and affordable medical devices from India to the world. So as we all know, India imports more than 85% of medical devices, and we have top engineers, top surgeons. We are the fourth largest economy, and we have 140 crore people market. So the question is why? Rocket was tough, we did it. Medical devices should be new forte for 1.4 billion of us. So see, here I'm going to talk about UnivLabs. And through UnivLabs, I would like to put across the point of view how the whole sector is energized. And traditionally, we as an Indian has a mindset that this we cannot do. Even if we have done something that may not be of very high quality. Shall we use it or not use it? So the work what UnivLabs is doing through that, I wish to uh, get the message down to the government officials as well as everybody present in this the hall that we are just limited now only by imagination, what the Chief Secretary sir has said. So when we started UnivLabs, there was a question, what should we make? So we thought that let's make the world's most complex medical devices. Then obviously the idea came CT scan and MRI. Definitely we can try, but those are national asset of few countries and it's very difficult. So we focused on surgical endovision system. Now you'll be happy to know that 4K laparoscope suit is now completely manufactured in India. I will go to my previous slides just to say this project has been funded by, when I came from US, I reached Department of Biotechnology for funding. And this is our credentials. We are government recognized startup. Uh, we are funded by Department of Biotechnology, Ministry of Electronics and MSME to the tune of 7 crores. We have received India Design Mark Award for our product. We have in last 8 years, we have expanded from two people company to more than 70 people. And we have market presence not only in India, but Africa, Middle East, and APAC countries as well. So see, this is a company which is built by engineers and surgeons. You can see here, Dr. Anil Mandhani, who is the co-founder of this company, he was the head of urology at SGPGI Lucknow for more than 20, like he served at SGPGI Lucknow for 20 years, a lot of innovations. So this company, Dr. Sanjay Sinha is also from SGPGI Lucknow. So we all are on mission to make India at least independent in surgical endovision technology. As I've covered this, we have done why not. So earlier it would be unimaginable that a bio drone, a bio capsule can come only from US. For example, this 4K surgical endovision system is now completely indigenized here in India. It has been installed across India into medical institutions as well as colleges. We have also developed flexible endoscopes and bio drones. Now see, this surgical endovision system is the kind of equipment which is required in each and every operating room. But multinational companies were charging exorbitant prices to our customers. UnivLabs offers the same product at par product, and in some features it is better at half the price. And DGHS, I will show you later, DGHS New Delhi has taken special initiative to showcase our product to uh, directors of all Indian Institute of Medical Sciences across India at their office in Nirman Bhavan. Now, I would also like to explain the power of innovation, what we are doing, like this government, be a state government, be a central government, be bureaucracy, collaborators, uh, the mindset is evolving. For example, see, in hospital setup, a catheter is used, which sometimes needs to uh, lead to bleeding. UnivLabs has developed a AM Safex catheter. It is a globally relevant patented product which will eliminate the hospital-based injury. We have come out with artificial bladder. Now, I think in next, after more than 18 months or maybe in 24 months, you won't see hanging bags. Their artificial bladder will come on in the market. People will use mobile phones to see their urine status, and it will bring their dignity back. Right now, prostate, after 60, most of the people develop prostate, and it is a very painful surgical procedure. So Dr. Anil Mandhani and a couple of engineers, we sat together and decided we are developing biodegradable stent along with IIT Roorkee. So if somebody has urine retention, he goes to the hospital in OPD or in minor surgery, surgeon installs a biodegradable stent. Now what happens? Surgery is postponed, no more hanging catheters, so life is easy. And for example, with Eurocath, right now, if somebody gets into a kidney surgery, then then a catheter is inserted. So before surgery and after 1 month of surgery, a patient has to again go to hospital to get that catheter removed. And for that, he has to undergo all the process of anesthesia, admission, surgery, and everything. So UnivLabs has come out with a special catheter in which the second hospitalization is not necessary. So this is our flagship product. I am presenting this product to all of you because here many of the government officials are here. And being a startup, we face a lot of challenges when we get into the market because there are already a lot of companies, multinational companies, which are well entrenched, and they are creating a lot of boundaries for indigenous companies to succeed. So this product is used in All India Institute of Medical Sciences, New Delhi. DGHS has asked many central hospitals, all hospitals across New Delhi to test and give a certificate, give a feedback to our product, and we have received fantastic response. And why laparoscopy? Why here I'm talking about laparoscopy surgery? You will know these are the statistics, what we have collected from our sources. There is extreme shortage of surgical equipment in India, not only in government setup, but also in private setups. The equipment whose life should be only 3 years, they are used for 10 years. And before I go to next slides, there are some government officials and I would like to put them. There is no need of 10-year AMC and CMC for medical equipments. In US, after 3 years, equipments are discarded, like because normally electronic equipment will have 3 to 5 years of maximum life. Otherwise, the electronics starts degrading. Even a hospital is a very corrosive environment. Equipment will not last 10 years. So government is just wasting its money by asking for 10 years AMC and CMC. Except CT scan and MRI, which are extremely high cost equipment, I believe other equipments, government should not ask for more than 3 to 5 years of warranty. Because technology changes, then the companies come and they give doctors a new product and he buys a new product. So ultimately, a surgeon is paying for AMC and CMC of old equipment, but not using them. So that point should be taken care of, and I have put this across DGHS in the Ministry of Health as well, to idle out the warranty period of medical equipment. So see, the laparoscopy surgery, which is a basic equipment, that is still like top of the line laparoscopy equipment is present in less than 5% hospitals. There are cancellation of surgeries are happening in hospitals because OT are not free, or equipment is not there, or equipment is not functional. In a premium, more than 100-year-old hospitals in a state government hospital in New Delhi, I would not name, they don't have a laparoscopy tower. They have only one set and they cater to a lot of patients. So surgeon will invite patient for a laparoscopy surgery, but since the machine is not free, machine is not functional, he'll ask patients, can I do open surgery for you? A country which is going to be fourth largest economy, it's a matter of shame for us that we are not having even basic equipments at, like even if they are there or they are not maintained. So we have to create a system of indigenization as well as affordability, service, maintenance. We have to bring synergy all across so that we can cater better to our population. So our products comes in various models at various cost factor. This is ICG top of the line. What the world best company offers ICG system to Mobilio for field surgeons, which can take all has been made. We thought that like multinational companies will give HD, 4K, low HD. When we decided when we decided to develop product, we thought that we'll give top of the line. We have all the 4K offerings and at the rate of like at least half the cost of multinational companies with longer warranty period. I think we were talking a lot about digital, so I think we developed this CSM software, a collaborative surgical module, which can be very useful in medical education setup. For example, right now, so this is a well comprehensive software where there can be a mentor surgeon, a surgeon in OT, a senior surgeon can guide a surgeon in OT with annotations, pay-per-use system is there. Patient surgical data can be saved on the server, which can be retrieved. The same surgical data can be put for education in mobile application, and at the same time, this data can be used for medical legal purposes. So this is and for Ayushman Bharat, I think Ayushman surgery and healthcare system, this software can be handy because right now, lot of patients go under surgery under government schemes, but what happened to the surgery? What is the outcome of the surgery? So we have included this software package along with our software and which also provides the AI capability. See, there can be a senior surgeon, junior surgeon, all the data is recorded. Surgeons can be present in a video conference in critical cases, and it can, for example, normally what happens, a patient gets himself admitted based on the HOD's name, but a junior surgeon starts the surgery. Assume junior surgeon is stuck somewhere, and senior surgeon is not available, he is in vacation, family function, chutti, or anything. So there, a silo is there in a hospital if a surgeon is not present, a senior and junior surgeon. So this software, CSM, makes their life easier. For example, when junior surgeon is stuck, he can share his live screen with a senior surgeon where senior surgeon can guide it. Even in government setup, for example, MP and UP, these are large states. You cannot have expert surgeons everywhere. At that place, this software, this system can come handy in live surgeries where multiple surgeons in various surgeries, it is not a remote surgery. It is like remote collaboration, how to handle a situation. Oh, sorry. So the product has been tested at top centers across India, Medanta, Fortis, AIMS, Apollo, and we have had outstanding reviews. Osmania, Railways, these all are our customers. All across. So normally when in India we make our product, we take to tier 2, tier 3 cities to experiment. At UnivLabs, when we made our product, our first customer, like the first place we took, it was Medanta. So that kind of confidence, and you can also have confidence in the top technology in the products what right now Indian innovators are doing. Because we are not competing among ourselves, we are competing with multinational companies to realize the vision of our Honorable Prime Minister and to make our nation great. I don't know if I can play this video. How to click it? Can somebody click on this video? Nahi hogi? Okay. So he's Dr. Desai as SGPGI Chandigarh. We had a surgery and we did not tell him that it is a UnivLabs machine. After the surgery, he gave a fantastic feedback that I was using the hand instrument of a German multinational. So I thought that this laparoscope tower is also of multinationals. All these feedbacks are available on YouTube. It was there. So this is the UnivLabs was invited at DGHS Nirman Bhavan, New Delhi, and the HODs of various central government funded hospitals were there. and they were showcased this product. Thereafter, the directors of All Indian Institute of Medical Sciences were there, and this presentation was done. So what I would also like to use this forum to communicate to the procurement heads that we alone cannot make India indigenous, like we cannot alone make India self-reliant. We need cooperation because we need also customers. So what we want from them is that have an open mind, that Indian companies as well as startups are committed, put generic specification for tenders, treat Indian approved product from CDSCO at par with US FDA and European C in multiple states. I cannot name even a single state where we are not facing resilience. Every product will come despite state governments and central government guidelines of using CDSCO approved, properly tested products. Consider them. US FDA and C is mentioned only so that the other Indian companies or innovators cannot participate. And I challenge you, I put here, we have lost only those tenders where we have got disqualified. We have not lost any tender where live surgery was done, where a proper assessment was done, and where the cost factor came. So we have lost every tender or service to the government of India, to the people, only because of restrictive conditions. So I would like all of you, I request whosoever in the position of responsibilities to take care of this and provide us equal opportunity. And I would also like to say, demand what you need, not over specification to eliminate local players. See, the Indian industry is evolving since last 10 years or maybe last 5 years. Now they cannot have all the product portfolio, assume 100 products. Now in a tender, in a single tender, it is said you all 100 products are needed and they should be from the same manufacturer. This is outrageous. How the young Indian companies who are coming up, they can have such a broad portfolio. So a proper specification based on the representation, a proper segmentation should be done, quality standards should be defined, and we should be given chance. So what I suggest is that demand quality, we are not asking any favor. Our demand quality, check quality, provide us a level playing field. Our vision is to make India independent in operating room equipments, and using this forum, I promise you that UnivLabs will become world #1 company in surgical endovision space in next 10 years and will become one of the top 10 players globally in medical devices segment. We all cannot go and fight on the borders, but we all can do what in our own spaces in which we hold our expertise. UnivLabs plans to invest 2,000 crores in next 5 years to build a mega medical devices factory, and I would uh, also like to have a follow-up meeting to explore the opportunities, what we can get, and we are doing well. We are a well-funded company. We have lot of follow-up things are coming up, and I will also like to speak to Ranjan sir in private if he gives the time. Thank you so much. Thank you. Thank you so much for your time.
Thank you so much, Sunil Singh sir. Uh, I will not. I would now like to request Ranjan Kumar sir to kindly present a speaker memento to Sunil sir. Sunil sir, please. Thank you so much, sir.